Hi, my name is Nikki and I'm one of the Rheumatology Specialist nurses at the RNHRD. This film is to give you more information on sulfasalazine. Sulfasalazine is a disease-modifying anti-rheumatic drug, or a DMARD for short. It works by reducing the activity of the body's immune system, which may be overactive in some conditions. It is usually prescribed in rheumatology and can be used to treat symptoms in rheumatoid arthritis, psoriatic arthritis and axial spondyloarthritis. It isn't a painkiller, but it reduces inflammation, which helps to decrease pain, stiffness and swelling in the joints, and may reduce the progression of your condition. Sulfasalazine is usually given as tablets, starting with 1 a day and building up each week to a maintenance dose of 2 tablets twice a day. The tablets have a special coating and should be swallowed whole. They should not be crushed, broken or chewed. Sulfasalazine might not work straight away and it can take up to 3 months before you notice any improvement. So it's important to keep taking it even if it doesn't seem to be working at first. You should continue taking it as prescribed even when your symptoms are improving and you start to feel better, as this will keep your condition under control long term. When you start sulfasalazine, you can carry on taking any non-steroidal anti-inflammatory drugs, painkillers or steroids if needed. Before starting sulfasalazine, you'll have bloods checked to ensure it is safe to start. You need to have blood tests whilst you're on this medication. Please check your clinic letter for details of these blood tests and when they need to be done, and you should make an appointment at your GP surgery when they are due. Most people don't have side effects from sulfasalazine, and if you do, they aren't usually serious. Sulfasalazine can cause you to feel sick, upset your stomach, cause loss of appetite, dizziness, skin rashes and sensitivity to sunlight. It can also turn your urine orange or stain contact lenses, but this is nothing to worry about. If you develop a more serious problem, such as a serious infection, a severe skin rash, a high temperature, sore throat, pale skin, unusual bruising or bleeding, unusual tiredness or weakness or any chest pain, an increase in heartbeat or feeling much more tired than usual, or notice any change in the amount of pee you produce or pain when peeing, please seek prompt medical attention and make the rheumatology team aware. There's no need to avoid alcohol whilst taking sulfasalazine, but you should stay within the government's recommended limits. This is 14 units of alcohol a week, spread throughout the week, rather than having them all in one go. In some circumstances, your doctor may advise lower limits. Sulfasalazine is compatible throughout pregnancy and with breastfeeding, providing the baby is healthy, full term, and did not have jaundice. High-dose folic acid should be taken if you're trying for a baby and during the first trimester of pregnancy. Folic acid reduces the risk of having a baby born with defects of the brain, spine or spinal cord, such as spina bifida. If you're planning a family or become pregnant, please contact the rheumatology team if you need advice. You don't have to stop taking sulfasalazine before trying to father a child. Sulfasalazine can reduce your sperm count, but this usually improves 2 to 3 months after you stop treatment. If you've been trying for a baby for a year or more whilst on sulfasalazine, please seek advice from your doctor. If you get chickenpox or shingles, then you will need treatment and you should contact your GP or 111 without delay. These illnesses can be worse than usual if you're on sulfasalazine. Sulfasalazine is not thought to increase the risk of infection unless it causes the rare side effect of low white blood cells. We recommend you have the one-off pneumonia vaccine and the yearly flu vaccine. You should also keep up to date with your COVID vaccine. Please contact us if you're unsure about whether or not you should be having a vaccination. If you're due to have surgery, you don't usually need to stop taking sulfasalazine, but please let your surgeon know that you take this medication. I hope that you found this information useful. Thanks for watching.